The TIMPIR acronym. So where did TIMPIR come from? In 2009, I was starting to work with students in clinical practicums kind of continuously. And I started to notice a trend in the novice nursing students. And that was number one, they were not able to apply the nursing process in their initial response to abnormal findings. So if they went in and did an assessment on a patient and found something like, say, for example, a blood pressure that was elevated or decreased, they weren't able to use the nursing process in the moment to kind of help them deal with the problem. And nor were they able to access or apply more advanced clinical decision-making tools in this initial response. Now, subsequently, when they'd go home and have a chance to think about things, write things down, have no distractions, be free of the stress of the clinical environment, then yes, they could start to apply a nursing process in terms of planning for the patient, and they could start to apply CDM tools in terms of kind of understanding the bigger picture and where the healthcare team intersects in their efforts for this patient, etc. But none of these tools, the process, nursing process, or this advanced CDM tool seem to help them in the moment. The novice nurse seemed to kind of freeze up. The novice student nurse would seem to kind of freeze up in these moments. And so shortly thereafter, within the next year or so, I started using a tool that I developed called the TIMPIR acronym. And the purpose of the TIMPIR acronym is intended to mobilize the novice student nurse's initial response to abnormal patient findings. So whatever it is, even if they look at lab work and find, say, hemoglobin's a bit low, they can look at that, isolate that, and start to use a TIMPIR acronym to explore that. Now, again, to remind you that subsequently, they can use the data gathered through the TIMPIR acronym to apply more advanced clinical decision-making tools. So, for example, later on, they may want to draw a concept map, for example, that shows the interaction between lab results, diagnosis, and medications, for example. But the TIMPIR acronym will help get them the data that they can plug into that CDM tool later on. This TIMPIR acronym is quite simple, and it's meant to be used for each abnormal clinical finding. So let's take a look at the acronym. So the acronym plays out like this. You get an abnormal finding. The student looks at trend. What's the trend on this? Is there an identifiable cause? Is there medications related to this, one way or the other? Is the prescriber, primary nurse, and anyone else we need basically aware of this on the team? What interventions? And these don't just include nursing interventions. This is where it differs from the nursing process. We're not just talking about nursing interventions here. We're looking at the whole wide team here. And then response. Although this acronym is really intended for acute care or surgical settings and intended for novice student nurses, it can be applied in other settings too, to some extent. So within each one of these components of the TIMPIR acronym, there's a set of questions that will help guide the student in terms of what they should be asking themselves, what data they should be gathering further, and who they should be collaborating with. And so if we look at each one of these sections and the questions that may accompany each, then we see trend here. They have a finding, like we'll use again the blood pressure as an example, and they ask themselves, when did this start? So they're going to have to dig through the chart to figure out when did this start. Is this the patient's usual baseline? Is it trajectory upwards or downwards? If we have a trend, which direction is the trend moving? Identifiable cause. Is there an event that preceded this? Is there a relevant primary or secondary diagnosis? So you can see how gathering this data will help them apply a more advanced clinical decision-making tool later on. But right now we're taking baby steps as we analyze each abnormal findings. And then for medications, are there meds that are causing this problem? Are there meds that could help alleviate this problem? This next one's really important, especially for the novice student nurse, because the student nurse is often working with the primary nurse. And the really first question they should ask is the primary nurse aware of this today? Because it's a step that a lot of novice student nurses miss, and then things wind up getting a little bit out of control or less control than they should be when the primary nurse is asking hours later, why wasn't I told about this? So is the primary nurse aware? And then after digging through the chart, the student should determine whether the prescriber is aware, because this tells us if the prescriber who's kind of guiding the medical interventions through prescriptions and orders, they should be aware of this. Are they aware of it? Let's find out. That's a really important step. The rest kind of plays out similar to the data action response model, same with the nursing process, the intervention. So what do we do? What are the nursing interventions? But beyond that, also, what are the other actual interventions of the interdisciplinary team? Does anyone else need to be informed about this in terms of interdisciplinary team? And then ours is your straight response, which is similar to nursing process and data action response, charting, that kind of thing. Well, how did the patient react? Resources related to TIMPIR, pretty much everything. But again, for that novice student nurse who doesn't quite know where to go, well, what did you get from the patient when you examined them? Sometimes you have to ask them, interview them about their blood pressure, for example. What's your blood pressure in the community? Looking at the flow sheets in your charts, looking at the patient history, and there's so many good places to get that. The ER report, if they've had a consult before surgery, there's usually a good history page there. Looking at their MAR can answer some of those questions in TIMPIR. Looking at lab and diagnostic reports, those will help answer some of the questions. They also help generate new abnormal findings. Because again, with TIMPIR, we're looking at every single abnormal finding. We're not trying to cluster things at this point. That is more of a clinical decision-making model when you're drawing concept maps. And again, that's a little more advanced. They need a little more time, some quiet time away from the patient. It's not helping you in the immediate moment. We're doing some quick work here to work in the immediate moment. So looking at those lab and diagnostic reports, and of course, looking at the interdisciplinary notes. This is really good to find out which team members are already involved in this issue. A really good way of finding out if the prescriber is aware of the issue. And here's an example. Okay, so just take BP, a 105/60. Imagining that the student looked at the charts and talked to the patients, et cetera, as discussed above, and determined that this is a low BP since post-op day 1, and it's been trending downward since then. So what are some possible causes for that? Well, it could be dehydration, could be blood loss. In fact, we could probably add in, if there's meds, which is actually comes up in the next one as well, that opioids might be lowering it. This, again, helping get that student on track, getting those juices flowing in terms of getting the data that they need to deal with this right away. Is the prescriber aware? Well, 4 days ago, the prescriber noted that it was 112/68. It's quite a bit lower now. The primary nurse is not aware of today's result yet, probably because the student just went in the room and got the result right now. So one of the things we need to do is inform the primary nurse right away, and either with the primary nurse or, whichever way makes sense in terms of the setup, the prescriber should be contacted because BP is quite low, and at minimum, we may want to give some IV fluids and potentially a blood transfusion, but we'd have to look at other data like lab work for that. And if there is PO intake, start initiating that and encouraging that as well. A response, well, it's too early for a response, but now we at least have a plan. A related piece of data, but again, with TIMPIR, we're not trying to cluster yet. We're looking at each piece of data in isolation at this point. So another piece of data that may be related to this patient, well, hemoglobin 79, and you may want to tie that in to the BP we just talked about. But again, the rule with TIMPIR is you're dealing with novice student nurses. You look at each piece of data on its own and start clustering later. These baby steps really help that novice nurse to get moving and not get overwhelmed. Okay, so hemoglobin is 79, looking at that. Well, what's the trend? Well, it was 67 post-op day 1. So that was quite a bit lower before. So it's been trending upwards since then. that's a good piece of data to know, and that we can be a little bit relieved about that. Well, identifiable causes is obviously blood loss and surgery, potentially poor PO intake, contributing to the anemia. Meds, it's a bit of a stretch, but they are prescribed anticoagulants. And if there is bleeding going on, which it doesn't look like there is because it's trending upwards, not downwards. But again, it's worth noting just to get that thought process in place that anticoagulants could contribute to bleeding if we thought there was bleeding, which again, in this case, I don't think we do because it's trending upwards. The P, the prescriber noted that hemoglobin is 71 4 days ago. So I think we're satisfied with that because they knew about this when it was much lower and it's already trending up. So I think we're good for that. The primary nurse is also aware. How would we know that? Well, depends on the situation. In this particular case, we're saying that, it was reported in the AM nursing rounds that hemoglobin was 79. So the primary nurse is already aware. Check. Okay. Intervention, contact prescriber for potential transfusion. Of course, that's something you want your student to think about. In reality, the prescriber is going to say, well, if your patient's asymptomatic, let's just try and give them some fluid for the low BP and call it a day. But again, that's a bit of advanced intuitive thinking based on experience. That's not even based on textbook stuff. That's that advanced intuitive thinking that your novice student nurse is not going to necessarily have yet. So we wouldn't knock them for saying contact prescriber for potential transfusion. It's actually a good thought. And when they get experience and apply to the situation, they might come up with a different conclusion. But again, TIMPIR is getting them there step by step, and we don't have a response yet. So that wraps up the TIMPIR presentation. Again, the purpose of this really is to mobilize thought and action of the novice student nurse in the initial response to abnormal findings. Again, the data that they gather from TIMPIR can be used at a later point for advanced clinical decision-making tools and applying a nursing process for kind of that advanced planning, long-term planning or medium-term planning for your patient.